They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us today for this episode of Being Well. I'm your host, Lacey Spence, and today we are talking virtual health or telehealth with our guest from Carle. We've got Dr. Charles Davies here with us today. Welcome.
Thank you for having me.
Of course. So since you're a new guest to the show, would you mind giving us a little bit of a background on what you are specializing in and how you ended up here in Central Illinois?
Certainly. So I am originally a neurologist by training. And then after completing that, I went on to a sleep fellowship. And so about 16 years ago, came to Central Illinois after finishing training and have been here at Carle as a sleep specialist ever since.
Excellent. So today we're talking about telehealth, and I feel like that's kind of been the health buzzword, at least for the last year. So what is telehealth?
Right. So telehealth can include either the actual visits that a patient might have with their provider, and ideally that would be video, of course, and audio. But it also encompasses other ways in which patient information can be viewed and interpreted by their provider. So, for example, in my field, we have now the benefit of the CPAP devices for treating sleep apnea that are able to collect information, and they have a wireless modem, and they can send that, they communicate with a cell tower and send it to a security protected cloud, and then the provider can look at the information, see how the patient's doing.
So it's not just the video chats, things are just getting more high-tech in general?
Right.
Is there anything else you can talk about that telehealth's kind of seeping into?
So also, again, in my field, we may have patients wear a device that would then collect some information. Again, in sleep medicine, we would want to know how much they're sleeping at night, and then that information can be collected and viewable by the provider to help with care.
So what's the difference between telehealth and telemedicine?
Good question, Lacey. So telemedicine would really indicate the specific interaction, the virtual visit, if you will, between the patient and the provider, whereas telehealth is more that umbrella term that encompasses not just the visits, but the devices, as I mentioned.
So how often is telehealth used? Is it a daily thing, or?
We're doing it all the time at Carle. And in fact, in our sleep clinic, we see every day we're seeing many patients using telehealth and a telemedicine visit with video and audio. And at Carle, it's up to about 2,000 telehealth visits per week. So it's grown quite rapidly.
Say, that seems like a lot. And so we are taping this in the summer of 2021, and I wanted to ask, was there an uptick in the telehealth use after the COVID-19 pandemic kind of settled in?
Absolutely, yes. We had to react quickly, of course, and I think Carle did a fantastic job with that. And we have, along the way, learned a lot, and we have optimized the platform that allows us to have that virtual visit with the video, real time with the patient. And so it definitely has evolved over time.
Do you remember when it was first introduced for you?
Yes, that was shortly after, of course, the March of 2020 when everything pretty much shut down. And so for a short time, we were not really able to complete visits at all. Of course, nobody was coming in physically to the clinic, but again, pretty quickly, Carle reacted, and we were able to, just within a couple weeks or so, start having video virtual visits with patients.
So definitely in a COVID-19 climate, you can see the benefits because you can still see your physician despite what's going on. But what other benefits are there to being able to take advantage of telehealth and telemedicine?
There are many benefits, I would say, for the provider and the patient. So one thing that is really nice is that, again, as a sleep specialist, I can have the patient show me their equipment that they're using. Now, we may, if there's a question that came up beforehand, if somebody's coming into the office, we may request that they bring in their mask or other equipment. But if it's something spontaneous that over the course of the visit comes up, then that's really nice that we are able to then have the patient just go bring their equipment and show it to us on the screen, and we can make suggestions that way, make sure that they're using it correctly, make sure it's fitting properly. Another thing that's very valuable is being able to have patients bring us their pill bottles, whether it's a prescription or even an over-the-counter vitamin or supplement, so that's really nice as well. Another thing that's really great about the platform that we use for our telemedicine visits is we can share screens. So we can, relating to that, the CPAP information I mentioned before, we can actually pull up the report and show the patient, bring that report right on the screen, and the patient can see just what I'm talking about regarding how well they're doing, how well the treatment is working for them.
And so if you're not incredibly familiar with telehealth, some folks might be worried about maybe their personal or health information not being secure. What would you say to somebody? Is it pretty safe?
It's completely secure.
Okay.
I would say people should rest assured that there is no problem with security. There's no way for number one, it's not being recorded, the appointment, and number two, it's completely secure, so there's no risk for their personal health information being shared with anybody else.
And Carle serves a pretty wide area, correct?
Absolutely.
And so how has this kind of helped bridge the gap for patients who are maybe a little more rural?
Right, it absolutely can make it more convenient, and I've seen in my own practice that patients who may have had difficulty or continue to have difficulty because of various reasons and they're further away, this makes it much easier for them, and so I think that's great, a great way to expand care and reach more people.
Definitely. And so with telehealth, we've talked about a lot of the benefits. Has there been any drawbacks to kind of going through this avenue a little more?
No, I wouldn't say. I think that it's going forward, and certainly I can't speak for insurance providers after the pandemic ends, whether they will continue to provide coverage for a telemedicine visit, but all indications are that they will. I would say that if I had to make a guess, I would say that this is certainly the benefits have been seen by both patients and providers, and that I would have to say that going forward, even after the pandemic ends, that patients will have more options. They can be seen in the office if they would prefer, or they can be seen via telemedicine.
So what type of patients can be seen for a telehealth visit? Does it just have to be your sleep patients, or
no,
what?
Anybody, everybody and anybody could be a telehealth patient.
At what point is it more just direction from your doctor as to when you would need to know whether you need to come in person, or how does that kind of work?
That is a conversation between the patient and their provider, and so typically we would determine based on the patient's needs if that would be appropriate for them to have a telehealth visit or not. In some instances, of course, we may need to do a full physical exam, and in that case, of course, we would have the patient come into the office. But for return visits, for example, and even some consults, we actually do have the ability to complete those as telehealth visits.
That's a good benefit, because I know it might be kind of hard to check out, this scrape on my arm, and then maybe the screen happens to get pixelated or anything. But I'm sure you've watched technology kind of move and adapt as well.
Right. Yeah, it has, and I really appreciate the technology. I think it's been great. Actually, even before the pandemic, for about 10 years now, I've been involved with what would be, let's say, called more traditional telemedicine, meaning that the patient is at another medical facility and there's somebody who is escorting them in and taking some vitals and assisting me on the other side. And so these are people for whom it's much more convenient for them to be seen at that other facility, and Carle has a relationship with that other medical facility. So I've been doing that for over 10 years now, but I think this really opens things up much more to allow these other options for people to have their appointments at home.
Definitely, and so that's definitely a benefit for the patient. What type of benefits are there for providers? You said that both sides were benefiting.
Certainly. So the provider, again, has the ability to maybe assess the home environment and also obtain additional information that they might not think of before the visit. That, let's say, if it was an in-office visit, the patient forgot to bring it. Let's say, again, in my field, there's something going on with their CPAP machine. So with the telehealth visit, the patient could simply bring their machine into the view for the video feed, and then the patient and the provider can go through that together. So that, I think, is a great benefit for the provider.
And can probably help with more accurate diagnosis of what's happening.
Right. I think it improves care, right, and it can make care more efficient. Mm-hmm.
So if I'm somebody who my doctor has suggested maybe swapping to telehealth, whether temporarily or permanently, do you have any tips for me to prepare for my telehealth visit?
Well, number one, most importantly, is always safety, patient safety. So absolutely, if a patient is going to be getting ready for or having a telehealth visit, they should certainly not be operating a motor vehicle while participating in the telehealth visit.
I think you bring up a good point, because I feel like a lot of people would be tempted to, I can do two things at once and just try to do it on the phone. Okay, continue, I'm sorry.
Oh, no, I think that's great to emphasize that point. And sometimes, actually, and I will actually expand maybe in terms of patient schedules, maybe they only have time during a lunch hour, and they might go into their car to have some privacy out in the parking lot from their place where they work, but of course if the car is parked and they're not operating it. Also, they should download any applications that they need in preparation for the visit. They certainly would want to have any medications handy. Having the visit being conducted through Wi-Fi helps with the feed and prevents things like lag time and pixelating and things like that. So that, I think, those kinds of things can help make the visit more efficient for both the patient and the provider.
Is there any level of vitals I can be taking at home, like my weight or things like that?
Well, that depends upon the particular patient and what they've discussed with their provider, but that would certainly be something that may be advised, let's say at the prior visit. Make sure that I would like you to check your blood pressure at home daily, and then have that ready for our visit next time. And then the nice thing about the telehealth visit is that the patient may even simply be able to write down their blood pressures on a piece of paper and just show that piece of paper on the screen, and then the provider is able to see all that.
Interesting. So are there ever any scenarios where telehealth is not advised?
If there's a medical emergency, absolutely. As always, as we are telling, and I think everybody knows this, but it certainly bears emphasizing, if there's a medical emergency, call 911. That's what people need to do.
Definitely. That first response is very important. I know one of our other episodes, we just talked about what you can do prior to an ambulance arriving, and a lot of it has to do with those great 911 dispatchers.
That's right.
So in your field, what would a typical telehealth call kind of look like, since you're talking about sleep in particular?
Well, I would, the way our platform works, we're able to see that when the patient arrives, they connect, and then I would go ahead and connect. And then I have the video and the audio, and just start asking how the patient's doing. And then for me, we have many people with obstructive sleep apnea who are using CPAP, and then I would again be able to share a screen which shows the download of their information, how their machine's working for them, and we can go through specific details. Is their pressure correct? Is their sleep apnea fully controlled? Because the machines can make that estimation, and also it can tell us how much the patient's been using the machine, and it can also give us an estimate of if there's any leaking going on, which of course is a very important piece of information when you're talking about that type of treatment.
So what type of age range do you happen to see?
I see adults. So any adult would be a good patient for a telehealth visit.
And have you noticed there's been a learning curve, whether it's just on the patient side or the provider side, when it comes to getting used to these type of platforms?
Yes, I think that that providers have certainly it's taken a little time to just get used to that, but then I think providers quickly adapt when they realize the benefits and the convenience for patients. On the patient side, it's a matter of knowing which application to download if they're having the telemedicine visit on their phone, or if they're using a computer, making sure that they're using the right browser. In the sleep medicine clinic, we send out instructions to patients outlining all of those recommendations so that patients are prepared.
And are there more resources somewhere online that you would like to share at all?
Well, actually, if there is a concern, or if a patient's having an issue with the technology while it's happening, there is a help number that they can call, which Carle has set up, and we have that number. I don't haven't memorized the number, but the patient help number, that's part of the information that we send to patients before the visit.
And to kind of circle back, how many typical calls did you say were telehealth visits?
So we have the visits, which would be mainly for us, it's almost exclusively video and audio as well. But for Carle as a whole, it's 2,000 a week, 2,000 telehealth visits we're having per week, which include not only sleep medicine, but behavioral health, endocrinology, certain pediatric departments. So it's expanding rapidly.
And are there any other services, maybe through you or through Carle, that you would be interested in talking about that's maybe being developed a bit more?
So, well, I think that in terms of rural health, I think this is going to be a huge area of focus in the future to try and expand care to people who have difficulty accessing health. So I think this will be a great opportunity using telehealth to not only have the visits, but again, as I mentioned, use technology, use devices that are able to collect information, and in a secure way, of course, and then be able to have that information transmitted back to the provider, and the provider can interpret it. An example of that also would be radiological images. So that's happening now as well.
And I'm sorry if you kind of hit it already, but were you able to talk about insurance at all? Are these visits being covered?
So that's a really excellent question, Lacey. And because there are so many different plans, and all of the insurance plans may have different rules around coverage for a telehealth visit, whether, and I will say that in the sleep clinic, most insurance providers do cover a video telehealth visit, but many of them do not cover a phone-only visit. So that's why we've pretty much moved exclusively to video. Has to include video if it's going to be a virtual or telehealth visit. But my advice to patients would be to specifically call their insurance company and ask about whether their plan would cover it or not.
And since we have you on the show and you are specializing in sleep, what would you say is the biggest condition that you see on a regular basis?
Obstructive sleep apnea is the most common condition that we see. We also see many patients with insomnia, and as you can imagine, insomnia, people may try home remedies, try working on it on their own beforehand. So I suspect that out in the community, that insomnia it may be even more prevalent than obstructive sleep apnea, but we know that obstructive sleep apnea is a huge issue. There are probably 20 million people in the U.S. with undiagnosed obstructive sleep apnea. So I think telehealth provides an opportunity to see more people and to expand access. We also see people with other sleep conditions, people who are night owls, so-called delayed sleep-wake phase disorder, as well as people with narcolepsy, people who are very sleepy, and we are able to treat those patients as well.
With the ability to potentially reach more patients, have you noticed your patient base growing at all?
I think so. And specifically relating to people with narcolepsy, some of them, because they're so sleepy, they're not allowed to drive. And so this would provide an additional option for them to have the visit.
And in our last few minutes here, are you able to share any advice with our viewers at home that might either help them with telehealth, with sleep, with any other general wellness?
Well, again, being a sleep specialist, I'm biased, but I would say that certainly sleep is one of the foundations of being well, of good health, along with good nutrition and physical activity. So I think those are the three main things. Always want to make sure you're eating healthy, getting enough physical activity, and getting at least 7 to 9 hours of sleep each night. But in terms of advice for telehealth, I would tell patients that it's great that we have this option now, and if they have any questions or they would like to request a telehealth visit, they can do that through My Carle, the My Carle patient portal. Actually, now Carle is even completing convenient care visits with request through My Carle as a virtual visit.
Can you talk about that a little bit more? What is convenient care?
Well, if a patient, let's say if it's not a frank medical emergency, in which case they should call 911. Let's say they had a scrape or something else is happening, which is not a serious issue right at that moment. They can go through the My Carle patient portal, for example, and request a virtual visit with convenient care. So convenient care is set up to handle these kinds of less severe issues that are going on that would not need to be addressed in the emergency department.
So it's not an emergency, and then probably also a situation where I can't exactly get into my primary doctor quickly.
Right.
So they've got their regular schedule and
right.
You're not able to sneak in. Gotcha. So it can be a telehealth visit, like you said, it can be pretty much for anything, for a specialist visit or even something as broad as convenient care.
That's right.
Excellent. Well, Dr. Davies, thank you so much for coming on our show.
Thank you, Lacey.
Of course. And thank you for joining us for Being Well. We will see you next time.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.